Hi, in today's video I'm going to talk about 5 types of eye floaters and what they mean for your vision. Hi, I'm Martin Aguzzi and this is Martin's Eye Tips. If you're new here, thank you for joining me. I'm a UK based optometrist. I've been in practice now for about 20 years. And on this channel, I create eye care videos designed to help people see better, see more comfortably, and have less anxiety about your eyes. So if you haven't subscribed to the channel, then please consider doing so. And let's get into today's video. So I wanted to make today's video just to explain a little bit about the types of floaters that we may get within the jelly in the eye called the vitreous. There are other situations where you may see bits flying about in your eyes as well. But today I'm talking exclusively about the type of floaters that you get within the jelly of your eye that we call the vitreous. I've also gone ahead today to do some mock-ups of the vitreous jelly with 5 different substances to kind of represent the 5 different type of floaters that I'll be talking about today. So hopefully that just is a little bit of a visual kind of illustration of what these type of floaters may look like. Now, I have previously made a video on what eye floaters are, and you can watch that video just by clicking the little link above. Now, first up, and in no particular order, is your standard floaters. And these floaters are the most common type of floaters because they are, for the most part, age-related. And what we see in these type of floaters is the situation where the jelly in your eyeball, which is normally quite solid, breaks down a little bit and you get a lot more movement in that jelly, which gives opportunity for collagen fibers that are within the vitreous jelly to clump together and form bigger blobs and patches that become visible as shadows in your vision as they move around. Now, standard floaters are very commonplace and most people will have floaters at some point in their lives, so they aren't really anything to worry about. They still need checking out though, and that's an important thing to remember. So for most people who get floaters, they often may speak to somebody else who tells them it's nothing to worry about, and they may never come in to get it checked out. But it is important to just get an eye care professional to have a look at the back of your eyes and just to confirm that it is floaters and everything else in the back of the eyes intact, and that no treatment or any further action is needed. So these vitreous floaters are very annoying even when they are just 1 or 2, and unfortunately it's something that you're going to be better off living with because treatment options just would be way too extreme for the odd 1 or 2 floaters. So most eye care professionals will tell you to leave them well alone, and unfortunately you have to just live with them. But they don't do any harm, and you may get a couple more added in the future. It's always worth getting them checked out if you get a sudden increase in number, just to make sure that the whole structure of the jelly in the back of the eye and the sac that contains the jelly is all intact. So in at number 2 is blood. And there are several situations where blood can enter into the vitreous jelly, and to the person that's experiencing this, it may look like a large shadow in your vision. Depending how bad the bleed is, it may obstruct all or part of your vision, and it may not look red in color. It actually just may look like a dark shadow over your vision. And any situation where you have a significant loss in vision, sudden loss in vision, shadows over your eyes or anything like that, you need to get that checked out as a matter of urgency. So what causes the bleeds in the eye? Well, there can be, as I said, a range of situations where you may get a bleed. One of the most common situations that might lead to a bleed in the eye is when the blood vessels that come into the eye, the central retinal artery and the central retinal vein, either one of those may get blocked, and it may get blocked up along the main route or along one of the branches within the eye. And when that happens, you may get a total kind of blowout of that blood vessel, and lots of blood can enter into the jelly in your eye. And this is often described as being a stroke in the eye. Other situations where you may get a significant bleed in the eye may be in situations of a retinal kind of tear, which might cause a tear in the blood vessels as well, or a retinal detachment, which might also tear a blood vessel or bring blood vessels down. And as I say, in these kind of situations, people usually know that they've got this going on, and it's most important that you get seen straight away, just so that urgent treatment can be kind of given to you really. I have to say, I mean, there are many situations where people, for whatever reason, maybe they're concerned about being a bother to eye care providers, that they don't go in straight away. People might often think that it's going to clear in an hour or two or a couple of days, so they sit and wait. And really, the longer you wait with these kind of situations, the more problematic it can be, and the more risk it can be to your eyes as well. Number 3 is inflammation. Now, inflammation within the eye is often very serious, especially if it's not dealt with very quickly with the appropriate drugs and treatment. But one of the most common causes of an inflammation within the eye is a uveitis. And as part of the inflammatory process, you get these white blood cells and debris that get released into the vitreous jelly. And to the person looking inside your eye, it just looks like a lot of fatty kind of white deposits within the eye. And it can cause a real obstruction to seeing. And often, people who have quite severe inflammatory conditions within the eye, like a severe uveitis, then the debris may get so much that it really causes a problem for you to see through, even after you've had the appropriate treatment. And these kind of candidates may well be very suitable for treatments like vitrectomy, which is where the jelly is kind of removed and artificial jelly is put in its place. Now, that procedure isn't without its risks. It's actually quite a significant risk of retinal detachments, eye infections. So it's not a procedure that is taken lightly, but it is an option there when the vision is so bad that it's worth taking that risk of having that procedure. And the 4th one is called asteroid hyalosis. Now, asteroid hyalosis is quite a common condition. I've seen it many times over the years. It's described as being a degenerative condition. So you do get degeneration within the vitreous itself. Within the eye, you get these deposits which look white and often very, very shimmery, glistening. That's part of how they get their name, the asteroid, because they kind of have this appearance like stars as they glisten. So in my illustration, I've got them as colored paper, and sometimes I have seen them so dramatic that it looks like you're just looking through shimmering, kind of like Swarovski crystals and diamonds, because they glisten so much. Now, surprisingly to the person that's experiencing them, they can still see through fairly well, although when it's really bad, it does become an obstruction. And certainly to the examiner looking into the eye, it can be very hard to see around it and see through them unless the eye is kind of dilated, so we can get a better view. Now, as dramatic as asteroid hyalosis may look, it's actually very harmless. It doesn't need any treatment for the most part, unless somebody has a real kind of obstruction to their vision caused by these asteroids. Then we wouldn't do anything about them. They're caused by a buildup of calcium, phosphate, and fatty deposits that build up in the degenerative process that goes on within the jelly. Now, I personally have patients who have had real problems with their asteroid hyalosis, and it's been a real big obstacle for driving, things like that, because at random times you just get a big blob floating past your vision, and it can be quite alarming for people and quite hazardous in many situations as well. So in those kind of instances, then treatment options are available, again, like vitrectomy. That would be the primary treatment option. You wouldn't do other options like YAG laser to kind of deal with them, because often there's so many of them to try and individually laser. And the 5th and final type of vitreous floater that I've got down is what we call a PVD. The PVD stands for posterior vitreous detachment. The posterior vitreous is the sac which contains the jelly in the eyeball. Now, this sac is held on in 2 points firmly, the hole out at the back of the eye and the hole out at the front of the eye. Now, with the posterior vitreous detachment, essentially what happens is that the point where the vitreous is welded on at the back of the eye comes away, and it comes loose, so it's no longer fixed to the back of the eyeball, and as a result you get this kind of pigmented ring which comes away and floats right in front of the person's field of vision. And typically then you get people describing what they would say would be like a cobweb or a lace ring. So in my illustration there with the balloon, you can see kind of the lace ring that I've put in there, and that's kind of representative of what people would see in that situation. That ring we call a vice ring, and you know, it's quite classical of a posterior vitreous detachment. Now whenever someone gets a posterior vitreous detachment, although it's very, very common, we see all the time, it does require a thorough checking of the eye just to make sure that there's no tears or breaks in that sac anywhere else. That might lead to a greater risk of retinal detachment, because fluid can now seep through any tear in the sac, and also again just to make sure the retina is not torn at any points as well. But for the most part, people who have posterior vitreous detachment will not need any treatment as long as there's no visible signs of tears or breaks in the structure of the vitreous sac itself or the retina. If everything checks out, then you know you're fine, and it doesn't necessarily have to be a problem again in the future. Okay, but it is definitely something that you need to get seen and get professional to have a look at, just to make sure everything's okay, to give you that all clear so you can kind of rest assured. And those are the 5 types of vitreous floaters that I wanted to go through with you in this video. Definitely love to hear your feedback on that, so if you care to share, then please let me know. Have you experienced any of these types of floaters? Have you had to have treatment before? You know, what's your experience being with each of these 5 types of floaters? So leave a message in the comment section, and I'd love to kind of get your feedback on that as well. And I'll see you in the next video.